South Carolina just had the biggest measles outbreak in modern history. 997 cases. 940 of those were in a single county, Spartanburg. Now, the first reaction is obviously low vaccination rates. And yes, almost everybody who got measles in this outbreak were unvaccinated. But it's more complicated than that. Spartanburg County, yeah, it's a little lower than the rest of South Carolina, but it's not that bad. Measles found something in South Carolina that doesn't show up in the public numbers. What was it? MMR vaccination rate is 91% in South Carolina. It's pretty much middle of the pack for the United States. Even Spartanburg County, which had almost all of the measles cases, has a vaccination rate of 88% in kindergartens. That doesn't scream at you the biggest modern measles outbreak in US history. Now let's be clear about one thing. This wasn't because the measles vaccine failed. MMR is a highly effective vaccine. Even with just one dose, your protection is quite high. If you have 2 doses fully vaccinated, your protection is 97% and probably for the rest of your life. And you can see this perfectly in the South Carolina outbreak. Of 997 cases, 932 were unvaccinated. Of those remaining, only 26 really had a true breakthrough infection, meaning they had 2 doses of MMR and still got infected. It means that the measles vaccine doesn't just protect the person who's taking it, it also prevents transmission. When measles is circulating in the community, if it hits somebody who's vaccinated, that's pretty much the end of the line. The problem was that the measles virus is able to find the people who were unvaccinated, and that happens more often than you think because measles spreads through contacts. That means that the way unvaccinated people are connected to each other is really, really important. Think about 2 different counties with the same vaccination rates. In one county, the unvaccinated people are scattered, which means that they go to work, but they're surrounded by vaccinated colleagues. They go to school, their classmates are vaccinated. In the other, the unvaccinated people are clustered together in the same social circles, churches, and schools. On paper, the 2 counties look exactly the same. They have the same vaccination rate. But to the measles virus, they're completely different. In the scattered county, when measles gets introduced, it rapidly hits a dead end and burns out. In the connected and clustered county, the measles virus can find another unvaccinated susceptible person to transmit to, and the chain goes on and on. A 15,000 person community in a large county like Spartanburg, that might only be 3 or 4%. But if those 15,000 people are socially connected, yes, that can sustain a huge measles outbreak. So the state can have a 91% vaccination rate. The county can have an 88% vaccination rate. But the network where the measles virus is transmitting, it's probably much, much lower. And once you understand that, the age and transmission patterns begin to make sense. What we learned from South Carolina is that measles outbreaks in the United States are almost always going to be among children. Of the 997 cases, 639 were between the age of 5 and 17. Infants are not old enough to get vaccinated, and children, sometimes their parents don't want them to be vaccinated. Ironically, the parents of those children are probably immune because they got vaccinated as children, and that protection is lasting for decades. Children are also part of very dense contact networks. They go to school, they're in daycares, churches, sports. These are all places where unvaccinated children might be congregating and be in very close contact. Measles loves that. Schools were heavily affected in South Carolina. One school that was the focus of many news reports at the beginning of the outbreak was Global Academy. It was a private charter school that serviced the Slavic community in Spartanburg County. Some of the news reports said that the vaccination rates there were only 21%. A school where 1 out of 5 children are up to date on vaccinations is a perfect place for a measles outbreak. But that doesn't mean that schools are the only place where transmission can occur. Families in a social network are going to come together at many social nodes, churches, even healthcare facilities. And we've seen this in other outbreaks in the United States. In 2022, in central Ohio, there was an outbreak of measles in the Somali community. It first started and was transmitted in daycare centers, but there was another secondary outbreak in a healthcare facility where an infected child transmitted measles to other Somali children and other non-Somali children as well. A school is only the most visible node of a connected social network. We need to think about all of the different places where measles transmission can happen, and that's at any place where families who are unvaccinated come together and are connected. South Carolina also fits another national trend, which is the gradual erosion of vaccine coverage. For the past 20 years, measles was considered eliminated in the United States. And it didn't mean that there were zero cases, because occasionally people would bring in measles from other countries. What it meant was that vaccination coverage was high enough so that the measles virus couldn't transmit, and that has been changing. Before the pandemic, MMR vaccination rates were 95%. 5 years later, after the pandemic, it's down to 92.5%. And that doesn't seem like much, but remember, the averages hide the outliers. So now there are more schools, more communities that have vaccination rates of 90% or lower. And even in the schools and communities that have very low vaccination rates, before it might have been only 60%, nowadays it might be 40% or 21%, like in the case of Global Academy in Spartanburg. Vaccination rates are not collapsing all across the United States uniformly. It means that there are more and more holes, and those holes are bigger. And that is why measles outbreaks happen in specific communities. This has happened time and time again. In the Somali community or in the Orthodox Jewish community. Last year in Texas, it started in a Mennonite community in Gaines County. And this year in South Carolina, in a Slavic community in Spartanburg. It is not all Slavic communities or all Mennonites or all Orthodox Jews that don't believe in vaccination. It is a specific school or a specific community, a specific church that share the belief that vaccination is harmful. This is why it is so hard to predict where the next outbreak will occur. The risk is at the local level, inside of a micro-community that is hidden inside of public averages. These micro-communities are becoming more and more common because of RFK Jr. and the rise of anti-vaccine ideology. Vaccine refusal has become mainstream and politically completely acceptable. The take-home point is not watch out for this group or that group. It is that measles will find the group that has low vaccination rates, that is susceptible. South Carolina needs a formal outbreak investigation, not just a list of case counts or a press release saying that the outbreak is officially over. We need to know how that community was connected to each other. What were all of the social nodes? And how did transmission occur? We need to know the vaccination rate inside of that community. Those details are going to be really important for next time. If the transmission was happening in the schools, there are things you can do to enforce and educate parents about the importance of vaccination. If transmission happened nosocomially in healthcare facilities, then those doctors and nurses need to implement new administrative controls, triage of suspected patients, and personal protective equipment. And if transmission was happening inside of churches, then religious and community leaders need to be an important part of the communication whenever there's an outbreak like this. But even without that formal analysis, South Carolina shows what it's going to look like. Because measles vaccination and vaccination coverage in general is gradually eroding. And the measles virus is going to find one of those gaps and explode. What is it going to look like? First, The cases are probably going to all be children. Second, schools and daycares are most likely going to be involved. 3, the outbreak is going to happen in a specific micro-community, a connected set of families who share the same beliefs about vaccines. And when it does happen, everybody is going to be surprised about the exact micro-community that is affected. This is the lesson of South Carolina. The biggest measles outbreak in modern history did not require the entire state to be unvaccinated, or even the county. And with vaccine refusal becoming more common, more organized, and more politically supported, there is no reason to think that South Carolina is some sort of outlier. This is definitely going to happen again. In fact, I predict that as unvaccinated children grow up, we're going to see more and more adults getting measles. You have to go back to the 1900s to see what happens when measles hits a susceptible population. The entire measles outbreak and resurgence is fascinating in the United States, and I'm going to be following it very closely right here on this channel.